when you are establishing a abdominal mode of breathing, that's the deep breathing, wherein you ask the patient to take a deep breath, let the stomach come out when you breathe in and let the stomach go in when you breathe out. That's how an abdominal breathing pattern is established. You spend a couple of sessions making the patient aware about his physiology and the movements, and making sure that there's no thoracic or clavicular movement involved, because that basically means that you're still not having an ideal abdominal breathing pattern. Slowly you take it from there, and your next step becomes where you synchronize breathing and speech. So now you want the patient to produce a prolonged exhalation, and with that he has to prolong a number. Number counting is much better because those are monosyllables, easy to do, and it does not have any linguistic loading, so it's much easier. So you ask the patient to take a deep breath. 1. So one breath, one number. I kind of left it halfway through, but I should prolong it even more, as long as I can prolong my exhalation. Then from there I take him to a step, spend couple of sessions in each step. Okay, then you take to the next level where you ask the patient to prolong one breath with 2 to 4 numbers. You don't go beyond 3 numbers actually, but recent studies have suggested that it's okay to even prolong it to the maximum possible vital capacity of the patient. So you can just go like 1, 2, 3, and then the next breath. That's how you synchronize his breathing with speaking 3 words fluently in one breath. From there, then you take it to the next level, wherein the patient is now going to take it to reading. So now in reading, what I mean is that I will be reading and the patient will be following it. So it's called like shadowing. So you will start reading any text, and the patient is supposed to shadow you, that's follow you exactly like how you are reading. So your model has to be perfect for this step. So you start it with a simple text and you go reading, wherein in one breath you produce at least 3 to 4 words. I went to the market. This went longer because my vital capacity is longer, but if you are dealing with a modeling case where you want to model the exact thing that he has to copy, go 3 words only. I went to the market in the morning. Every time after 3 words I was stopping, that's when the patient will be repeating it after me. Then from you keeping a control, you transfer it to the patient, wherein the patient will read independently and he will take deep breath and just prolong it with 3-4 words. So he is in control of his speech totally. You can do one thing just to give him a cue for breathing, that after every 3 words you can put a marking using a pen, or you can just underline the last 4th word of the text just to give him a cue of reading. And thereafter the final step comes when it's the conversation. Now you want him to transfer his abdominal breathing and the ideal breathing pattern to conversation. Completely uncontrolled situation where the patient himself should be able to monitor how much he can talk in one breath and how much he can be sustaining with stutter-free speech. So this step comes off lately, very lastly, when you feel that now the patient is able to take control of the situation. This is just in brief about how fluency shaping therapy can occur. Here I did not correct any of his block. What I emphasized was what's an ideal breathing pattern, how a fluent speech can be produced, and I started shaping his physiology to a fluent speech physiology. So this is fluency shaping therapy approach.